It's been 2 months of quarantine now, and there's something called quarantine fatigue that doctors are warning about. I'm joined by Dr. Tracy Cipriano, a psychologist and clinical professor at the Yale School of Medicine. Thank you for being with us, doctor.
Thank you for having me. I pronounce it Cipriano, by the way.
Cipriano,
Did I
thank
say
you.
that?
Yeah,
Yes.
no, that's great. I want to make sure, I wanted to ask you before, but now we can talk live. So it's Cipriano. Okay, thank you for being with us,
Yes.
Dr. Cipriano.
Thank you. So quarantine fatigue, it's not a medical diagnosis, but it's a term being used to help describe some of the feelings that people are experiencing after being stuck at home for over 2 months. And these things include restlessness, as well as feelings of a lack of energy, tiredness, feeling less motivated. And all of these things stem from boredom and a lack of stimulation in your life, as well as chronic stress from the many things that are going on right now.
Yeah, so how do we know if this depression and anxiety is normal, because a lot of us are feeling a little stressed, or it's something that we need help with?
Sure. I mean, the concern is that the chronic stress will turn into a long-term depression. And some of the things you need to pay attention to, are you feeling especially sad? Are you crying every day? Are you feeling hopeless? Are you having trouble focusing or concentrating on anything? You find that you don't get pleasure out of things that used to give you pleasure. You find that you're not interested in things, or I just don't care anymore. Or perhaps even having trouble sleeping. You're up a lot at night or sleeping all day. These are all signs that there's a problem.
What can you do about it? I think people are hesitant to call because they think, well, what can she do for me?
People should never hesitate to call. I think it's always, if you're even questioning that there's something going on, that trust your instincts and call and talk to someone. And if they tell you don't need any more, fine, but reach out. And so there are a lot of things you can do. You should exercise daily. Exercise boosts our mood. It decreases stress. It helps us sleep. Try to get outside every day. It's another mood booster. One thing you can do to prevent that Groundhog Day effect where one day bleeds into the next is to try to structure different things on different days. So if there are certain chores or pleasurable activities you do, say Monday I do this, Tuesday I do that, to help give yourself something to look forward to. Some other things you can do, meditation or breathing exercises. Doing something for someone else is a great thing to do. And I also want to highlight, it's really important to acknowledge your feelings and your worries. Don't bottle them up. You might be able to write in a journal and give yourself a few minutes to do that, and then shift your focus. Focus on something positive, focus on something you have control over, because even in the worst of times, there's always something that we can feel good about. Try to find that thing.
And there is professional help. We want to let people know that they can reach out. There's a lot of virtual health right now. They don't even have to go to an office, and you can help people that way.
Absolutely, yes. Very easy to do, very easy right now to get an appointment.
Dr. Cipriano, thank you so much for sharing your wisdom, and we do hope people are all realizing that we're getting through this together.
Thank you for having me.
Thank you.